Welcome to the IHCP Updates presentation. I am Virginia Hudson, Provider Field Consultant for Region 5. I will be taking you through the presentation today. Our agenda is to review several items with you today: expanded benefits for emergency services, emergency diagnosis codes, as well as vaccines for children updates. We're going to talk briefly about the electronic visit verification, hospital-to-hospital transport, portal attachments, the claim code that has been added to the portal windows, new adjustment reason codes, inpatient care for serious mental illness, contacting customer service, as well as general updates, helpful tools, and the last slide says questions, but of course we'll be not taking any questions as this is a recorded presentation. As always, we have this agenda for you that details the subjects being reviewed today. For your convenience, when this presentation is posted on our IHCP website, all of the blue links you see in this presentation will be hyperlinks. So if you want a quick access to any of the reference materials or sites mentioned during the presentation, you can click on the blue link. During the presentation, when I refer to the IHCP website, I am referencing the in.gov/Medicaid/providers IHCP website, not the IHCP Provider Healthcare Portal. When discussing the portal, I will distinctly state the portal. So we're going to start off with expanded benefits for emergency services. Emergency services must meet the definition that you see before you on this slide. It is here for your reference, and you can find this specific information on the IHCP website in the Member Eligibility and Benefit Coverage module, online, Section 2. Members assigned to Package E benefit plan, which is emergency services only, are non-citizens who meet immigration criteria that is very specific. Remember, all eligibility and benefit packages are determined by the Division of Family Resources, also known as the DFR. Some examples of emergency medical conditions include labor and delivery, including a C-section, suspected heart attack or stroke, and eye injury that could cause loss of vision. Unless otherwise noted on the fee schedule online or dictated by IHCP policy, coverage for Package E benefits do not require prior authorization, or what we refer to as PA. This new benefit package, it was referred to in the bulletin BT 201963, Package B Emergency Services Only Coverage with Pregnancy Coverage. It was announced in the bulletin in November 2019. To qualify for the package, a member must have immigration status, eligibility for Package E, and be pregnant or within the 60-day postpartum period. The difference in this coverage and the Package E only coverage is that the member will receive prenatal coverage as well as coverage for delivery on top of the normal Package E benefits. When billing for these services on the 1500 claim form, the Y emergency indicator must be present on the claim. On the UB04 institutional claim, there must be a prenatal or postpartum diagnosis present. In relation to paper claims, this would be in field 24C on the 1500 claim form. For the UB04, the diagnosis must be in one of the diagnosis fields, 66 through 69. Remember, for all claims, if you indicate that your claim is an emergency and use the emergency indicator and/or diagnosis, you must have documentation to substantiate that indication in the medical record in the event of an audit. This slide shows a larger screenshot of the coverage and how it will be listed on the eligibility screen on the portal. Note that under the coverage it states ESO coverage with pregnancy coverage. We have many questions on how does the IHCP or DFR know the member should be added to the ESO coverage with pregnancy. For this to happen, the member must notify the DFR of the pregnancy for this change to occur in their benefits. So if you have a member under Package E and then they become pregnant, please redirect your member to contact their caseworker for an update. Now we're going to talk about emergency diagnosis codes. So speaking of emergency benefits, the IHCP State Auto Pay Emergency Code List has been posted to the IHCP website. There was a bulletin posted, Bulletin 2020-09, posted in January, notifying providers of this addition to the code sets page. I have a screen print or a partial screen print of the code sets page on this slide. The Emergency Department Auto Pay list is specifically listed under the General Billing Codes section on the code sets page. There have been several additions to the auto pay list recently. Examples are B97.29, Z20.828, U07.1. These were all notified to the providers in provider communications and will continue to be notified in that manner. So it is ultimately important that all providers monitor the banners and bulletins to know when there are additions or subtractions to the emergency auto pay list or any other IHCP policies. So to do that, make sure that you're signed up for automatic email notifications so that when changes occur, be they long-term or temporary changes due to certain urgent situations, you're aware of the changes and can appropriately bill within the guidelines. If you're not signed up yet, so you can stay up to date on the latest changes to billing, services, prior authorization, and other changes, click on the Notify Me option on your homepage of the portal. You can also do this on the IHCP website from the home page under Get Important News and Updates. Next, we will go over a few changes to vaccine for children. In October 2019, a bulletin posted BT 2019-60, which detailed the changes to the Vaccines for Children program. A big change was the increase of administration payment to $15 per dose. Additional information was posted also to remind providers that when performing a well child visit, that the VFC administration fee is included in the payment for the well child visit E&M code. Also, instruction was given that when billing a VFC claim, the SL modifier is required on the administration. If the vaccine is available from the VFC program, providers must use the VFC stock rather than private stock for children under the age of 19. More information on VFC billing can be found on the IHCP website at the Vaccines for Children Information for Providers page at in.gov/ISDH also. You can find the VFC module online at the IHCP website for more details on billing and reimbursement. Let's review the status of electronic visit verification. The requirement to use an electronic visit verification or EVV system that was scheduled for January 1st, 2020 was delayed to January 1st of 2021. In May of 2019, Banner 2019-51 was posted that notified providers of the delay. EVV self-paced training has been posted to the IHCP website under the Provider Education page. There is training specific to providers that will be using the state-sponsored SANDATA EVV system listed in Bulletin 2019-42, posted in July of 2019. This bulletin contains a checklist to assist providers in getting ready for the January 1, 2021 implementation date, as well as requirements. There's another bulletin targeting providers using a system other than SANDATA, or what is referred to as an alternate EVV system. This bulletin is 2019-46. If you're using an alternate EVV system, be sure to review this bulletin. Regardless of the system you've purchased to meet this requirement, training is essential for internal staff and your caregivers. We strongly encourage providers to get the system chosen up and running, train your caregivers and office staff on that EVV system as soon as possible. We also suggest that employees begin using your system by midsummer to avoid having a large number of exceptions or errors on the go-live date of January 1 in 2021. Hospital-to-hospital transport. In Banner 2020-01 that posted in January of this year, the IHCP provided guidance for non-emergency medical transport for hospital-to-hospital fee-for-service claims. The words non-emergency medical transport are very important in this situation. This information in the banner is only for ambulance providers with a provider type of 26 and a specialty of 260. The banner instructs providers that these claims are billed to DXC, not Southeast Trans. Retroactively, as of date of service September 4th, 2018, wheelchair trips are now reimbursed for A0130 in combination with the HH modifier. The modifier HH indicates a transport from hospital to hospital. If the HH modifier is not present on the claim will deny. Also, code A0425 is payable when billed with modifiers U5 and VHH. The claims with the date of service 9/4 of 18 to December of 2019 previously billed for these services and billed as detailed in the banner prior to publication date were mass adjusted. If your claim was billed as we described and for some reason did not get included in the mass adjustment, please attach a copy of the banner with your claim and send a note with it to Waive Timely Filing, see attached banner. If you have issues with these claims, please contact your provider field consultant. Portal attachments. In early 2020, the ability to upload a number of attachments in the portal for provider enrollment was expanded. With the implementation of the expansion, providers are no longer allowed to send paper attachments for portal enrollment transactions. The allowed attachment types for portal are noted on the slide in front of you. Examples are PDF, BMP, JPEG, and so on. There are times when a provider enrollment unit may request paper documentation from providers based on specific and unique situations. If the provider enrollment unit does request special documentation via email, please do not password protect your documentation. If the documentation has PHI, private healthcare information, such as a social security number, be sure to send that documentation via secure email. Claim codes. A few months ago, when you logged into the portal and were providing claim information and you got to step 2, you saw that there was a new field added to the portal. It is a field called claim codes. Unless you are a specific type of provider in which the claim code is required based on the services you perform, this field can be bypassed. The form description states claim codes. The claim codes identify additional information about the patient's condition on the claim. This is an optional field. But what I have found is that if you click in that field and then determine you don't need to enter anything and then try to continue at the bottom of step 2, it will not let you bypass this window. At that point, what you will need to do is to click the Go Back to Step 1 button to get through the claim. From there, you will continue and just continue past the claim code. But if you do click in that field, it will prevent your claim from being able to be continued. New Adjustment Reason Codes, or ARCs, A-R-C-S. New, effective for dates of service 2/28 of 20. The ICP will allow providers to use additional ARC codes on their claim rather than upload TPL payment EOBs on portal claims. Banner 2020-04 announced additional ARC codes available for processing claims via the portal. These codes announced in the banner are in addition to the ARCs listed in the Claim Submission and Processing module, Section 5 on the IHCP website. Please review the module in combination with the banner for full details. Upon the next update of that module, these additional ARCs will be added. Inpatient care for serious mental illness. Short-term inpatient stays for SMI was expanded effective January 1 of 2020. The provider requirement is providers must be type 01 with a provider specialty of 011 and be approved as a private mental health institution by the Division of Mental Health and Addiction, or what we refer to as DMHA. Additionally, this requirement is for institutions of 16 beds or more. The change affects coverage for members between the ages of 21 through 64 with the full Medicaid benefit coverage, which includes managed care packages of full Medicaid. As noted on the slide, there are excluded aid categories due to restrictions in those aid categories, like your qualified Medicare beneficiary, family planning. The policy states that the average length of stay for these services is less than 30 days, and claims that are submitted for the inpatient stays of more than 60 days will be denied. Prior authorization is required for fee-for-service members. For full details, please review Bulletin 2020-03 in full on the IHCP website. Please direct all managed care questions directly to the managed care entities. Customer service. Customer service gets a lot of calls every day. There are specific requests that the customer service unit at DXC can assist you with. They can give you service usage on benefit limits, help with checks, accounts receivable, and RA information, TPL updates, claim denial questions, and procedure code lookup. However, there are some items that the customer service unit is unable to assist you with. They cannot assist you with member eligibility checking and benefit plan information because this information can be obtained via the provider healthcare portal or the IVR interactive voice response system. For more information, you can view instructions in the Provider Healthcare Portal module online at the IHCP website. If you have additional training needs, please contact your provider field consultant. For some general updates, there was a 3% reduction in inpatient and outpatient hospital services that has been extended. This extension is through June 30, 2021. This announcement was made in the March 2020 bulletin, BT 202010. As has been the case for hospitals participating in the HAF, the 3% inpatient and outpatient reductions will not apply while HAF is in effect, and with the exception of outpatient laboratory. Banner 2019-45 had an announcement some time ago that stated mental health mid-level practitioners will be able to enroll as rendering IHCP providers soon and watch for publications. As of this moment, there have been no additional publications regarding this, and no date has been set for this provider type to enroll. But please watch for future IHCP publications always. The next slide is our helpful tools slide. I referred a few times to contacting your provider field consultant. On this slide, you will see the state of Indiana that is divided into 5 different quadrants, or not quadrants, 5 different sections. And to the right of that, you will see your field consultants listed along with their email address and their telephone number. This information is available under the Contact Us in the IHCP website. So if you do not know who your field consultant is or do not know their email or phone number, please go to the IHCP website under Contact Us under Provider Relations Consultants. As mentioned several times throughout this presentation, the IHCP website is at in.gov/Medicaid/providers. There you will find your reference modules, your medical policy manual, which is really important to know where it is and what is in it. The Contact Us, as I was just telling you about, all your bulletins, all your banners, special pages such as the telemedicine pages, the FAQ pages, provider enrollment. There's a lot of information out on the site for you to benefit from. We have customer assistance notes available to assist you with understanding denials and problem claims, as well as general billing questions. And we have that listed there. And then there is secure correspondence, which is your written correspondence. And that is an avenue that is best used via the portal versus mailing in written correspondence inquiries. Administrative reviews can be sent via the portal written correspondence, but don't forget, whenever you send in an administrative review, we do require that you send a paper claim along with an explanation of the reason for the review request and substantiating documentation. Providers should not use written correspondence as an avenue for resubmission or submission of claims. If your claim has denied, correct it and resubmit it via your normal submission channels, either via your claim system or via the portal. Either will do. And of course, we do take paper claims, but we suggest strongly that you send claims electronically. Please do not use written correspondence for PA appeals or requests. These requests must be sent directly to the prior authorization unit. That is the presentation wrap-up for today. I want to thank you all for your attention, and please do not forget to use the IHCP website at in.gov/Medicaid/providers.